All right. Welcome to the 7th Annual Women's Heart Symposium. This year we're doing it a bit differently. We're on Zoom as the pandemic has forced us to do things that we don't want to do, but it'll hopefully in the next few years we'll get back in person. We have a great program this year. We're looking forward to hearing from all of our speakers. It's been a tough year for some people, and a lot of things have changed. I think we can all sort of reflect back and see either the bad things and the good things. The good things for me this year is I've had a few new grandchildren, and I've been able to see patients in the clinic, which is what I really like to do. So this year we're hoping to bring along a lot of information for you, and I'm going to have the pleasure of introducing Dr. Rosman, who first came to UNC, I believe, in 2019, and actually ended up on the same clinic day as me. So I got to know Lindsey pretty well. Mondays, where we were in our old clinic, were pretty tight, and you got very cozy. So Lindsey, it was fun to have you there, and still fun to have you there, even in the new Eastgate bigger building. Lindsey comes by way of East Carolina University, so I know there's some Pirate fans out there, and Brown University, and then most recently, I guess, Yale, where she did her fellowship. And she's going to talk to us today about depression and stress and cardiovascular disease. Lindsey, how are you doing?
Good, good. And thank you so much for having me here today. It's such a pleasure to be here. I was thinking about how my life's changed since I first came here in fall 2019, and it's been substantial, but I will say that it's been a pleasure to work with Dr. Miller and the other cardiologists here at UNC during such difficult times. I can say it's an absolute privilege to work with this dedicated team of healthcare providers. So I feel very fortunate to be here to work with our patients. So it's just been a pleasure to be here. So I'm going to go ahead and share my screen. And hopefully that looks okay to everybody.
Great.
All right. So my talk today is going to focus on depression, stress, and cardiovascular disease. Again, I'm a clinical health psychologist, and about 75% of my time is spent doing research on risk factors for cardiovascular disease as well as health outcomes. And in particular, a lot of my work is focused on women's cardiovascular health. So it's just a real privilege to be speaking here today. So I'm going to start off by talking about depression, stress, and anxiety, how stress affects your heart, and also developing an action plan to better manage stress to reduce risk of cardiovascular disease. And there are a lot of resources provided at the end of the presentation, which I know you guys are getting as well. I've got about 15 minutes to do this, so I'm going to hit the highlights, but feel free to ask questions or follow up with me after the presentation. So about 17% of adults in the United States have clinical depression, and it's twice as common in women than in men. And in patients with heart disease, the rates of depression are actually 2 to 3 times higher. Most studies find about 44% of patients with heart disease experience depression at some point. And one of the things I really wanted to highlight are that the symptoms of depression may look different in different people. Some people may experience that depressed mood or sadness or loss of interest. But for other people, depression doesn't really feel like sadness. It can feel like an exhaustion, feeling more irritable or not having the desire to do the stuff that they used to love. So again, just taking into perspective that depression for one person can look very different than it does in another person. And I like to reinforce the idea that everyone feels sad or depressed at times. It's completely normal after experiencing loss or a stressful situation to feel depressed for a few days, even a week or two. Clinical depression is different in that it's a much stronger feeling and it tends to last longer. So when you're thinking about whether depression is a problem, if it's persistent, if it's excessive or feels difficult to control and is causing significant distress or affecting your health or relationships, that might be something to look into further. Anxiety is a feeling of worry or nervousness. And again, being anxious before a presentation at work or a stressful event is completely normal. Anxiety becomes more of a problem when it's persistent, excessive, or feels difficult to control. and affects your general health, well-being, and your relationships with others. Women are twice as likely as men to be diagnosed with an anxiety disorder. And in particular, I want to highlight this picture because it shows what the experience of a panic attack might feel like. The most common disorders are generalized anxiety and panic disorders. And it can feel like all of these feelings at once, or having a billion thoughts and none of them are helpful. And for some people, they can even feel frozen in place. So again, when you're thinking of what the symptoms are, anxiety, it's that uncontrollable worry. It can be a feeling of restlessness, irritability, intense fear or dread, or panic attacks, or that tendency just to overreact to stressful situations. And we know that about 20% of patients with heart disease meet criteria for an anxiety disorder. And unfortunately, relatively few, only about a third, receive any treatment, but about half of patients with anxiety want treatment. I also wanted to specifically focus on health anxiety. And what I mean by health anxiety is this intense worry about their health or bodily sensations or symptoms that are often misinterpreted as a sign of a serious medical problem. And for people, it can look like excessive checking or symptom monitoring, like monitoring your heart rate periodically throughout the day and feeling anxious when you're doing it, or using a smartwatch, or frequently seeking reassurance from medical providers. Patients with health anxiety may also spend a lot of time searching for information about their symptoms. Dr. Google is periodically brought up in our clinic. When you think of health anxiety, it can be a person who has real medical problems, whether it's heart disease or history of diabetes or stroke. So there are people who often have very real medical problems, but their response to those medical problems is more intense, excessive, and potentially getting in the way of their mental health, their physical health, and interfering in their relationships. So again, health anxiety often occurs in people with very real medical conditions. It's about understanding that response system and attenuating its effects. And we think of what the issue with health anxiety is. It's associated with a higher symptom burden. It's also more prevalent in women than in men, and it's associated with worse quality of life. So it's important, if you're experiencing those symptoms, to have those addressed. I think this is probably one of the most meaningful slides that I like to share, and it's something I frequently will talk about in our clinic. Oftentimes people think that depression or anxiety or stress is a sign of weakness, an inability to suck it up, or that they're not trying hard enough. And that just couldn't be further from the truth. A number of things actually cause depression, and none of it's a lack of willpower. Things like having a chemical imbalance, grief, loss. There are genetic factors as well, a desire to be perfect, lack of social support. There are a number of causes, none of which are a lack of willpower. More recently, I think another stressor are these population-wide stressors like COVID-19 and a global pandemic. And there are the immediate and long-term effects on people's mental health and physical health outcomes, particularly in patients with cardiovascular disease. A lot of the research that we're doing here in cardiology has focused on understanding how patients may have experienced increases in anxiety, depression, or emotional distress over the past year and a half. We've also been paying attention to medical misinformation. So there's been a lot of misinformation about the virus, potential treatments online and on social media. And that can cause patients to be concerned about their medications or concerned about their risk for the virus, or potentially try treatments that are potentially harmful to their health. For example, drinking bleach is not a great way to prevent or treat COVID-19. But when those stories were hitting the news, there was a tremendous spike in poison control center calls about people ingesting cleaning fluids. So again, what appears on TV has very real health effects in real life. Other things like grief and mourning the loss of coworkers, families, and friends who have actually died of COVID-19. So again, there are a lot of immediate effects, but also long-term effects. This is data from a study that we are in the process of submitting for publication in a cardiology journal. It was 6,800 patients here at UNC. And as you can see, we looked at their physical activity data during COVID, because physical activity and low levels of physical activity actually are associated with a higher risk of cardiovascular disease. We also wanted to see, how does depression affect that, and particularly in men versus women. And as you can see from these images, if you look specifically at the solid lines, those are people who are depressed in blue versus not depressed in red. And you can see that in general, there's a huge difference based on their depression levels, such that folks who are depressed tend to be less active than people who are not depressed, and that pattern is similar in women and men. I also want to point out that women were less active before COVID, and that they experienced a greater reduction in daily physical activity during COVID. And that's important because we'll want to develop interventions to target women specifically to increase their physical activity. And that's going to be a next step for us here at UNC Cardiology, because we want to reduce women's risk for adverse outcomes. I think understanding more broadly how stress affects your health is also very important. When your stress response system, or that fight or flight system, is activated during periods of acute and even more chronic stress, it causes an increase in your heart rate, your blood pressure, and that can increase blood clotting and also increases your risk of an irregular heart rhythm. And it also makes your heart in general work harder. Depression can also affect our risk for cardiovascular disease because it affects how engaged we are in various health behaviors. So when we're feeling more stressed out, anxious, or depressed, we're less likely to engage in positive health behaviors like exercise, but things like overeating, smoking, and possibly not taking prescription medications might increase. And all of that sort of works together and increases the risk for heart disease, diabetes, and stroke. And there's a great deal of literature to support how these all interact with each other. And it just really highlights why it's important to pay attention to anxiety, stress, and mental health symptoms, because it plays a very critical role in how your heart functions and how your risk for cardiovascular disease is affected. We've kind of gone over how anxiety, stress, depression may affect risk for heart disease, and how it affects your body specifically. So I think it's really important to end with an action plan. So if you're experiencing stress, how do we manage it to reduce your risk? And what I tell people in clinic is the number one thing is to know your symptoms. Like we said before, stress affects everyone differently. Recognizing those symptoms early can help you take action to stop that cycle before it starts. We typically think of stress in a cognitive behavioral model. So for example, if you have this thought that you can't cope, it may trigger feelings of being anxious or physical sensations of anxiety. And we're feeling anxious, we may be less likely to engage in health behaviors. And when we're less active, our mood becomes more down, and that can make you feel like, oh, this must be very bad, something terrible is going to happen. And pretty soon that initial thought becomes a trigger for a vicious cycle that over time can quickly turn into a tornado. So by recognizing those thoughts early on, those feelings early on, hopefully we can intervene so that that vicious tornado doesn't happen. I think in general, a big thing I always like to highlight at women's cardiovascular health events is the idea that women in general, we tend to put ourselves at the bottom of our to-do list. We'll make sure that there's dinner on the table, groceries in the refrigerator, that the laundry's neatly folded, and maybe at the end of the day, we might remember to do something for ourselves. We will take care of our loved ones way before we remember to do things for ourselves. And we do that because in general, we tend to think that we're very capable and we're competent. And if you're like me, it's not always easy to ask for help. We also don't want to disappoint the people we love. And if we worry enough that, if we stop to think about it, we might all fall apart. So those are some of the reasons that we might put ourselves lower on that to-do list. But this is where I kind of change gears and I highlight why it's important to put yourself first. You will take better care of the people you love when your own needs are met. You'll also be in a better position to manage difficult decisions about your health and treatment options if you have cardiovascular disease or diabetes or another health condition. You'll also have the mental and physical energy to quickly shift gears if you encounter something unexpected, like heart disease, a new virus, or a global pandemic. So again, it's incredibly important to prioritize your health. I always like to give the analogy that if you're on an airplane, they always say to put your mask on first and then help the person next to you. The same applies to your mental health. I also like to encourage patients and women in particular to gain knowledge about their health. So people tend to feel less anxious when they know what to expect about their illness or their treatment. And I also encourage folks to ask their care team about their treatment options, expected responses, and also about their preferences for care and treatment. I also encourage folks to get information from reliable sources. Typically, that's not social media. If you have questions about medications or various activities to reduce your risk for heart disease, ask your doctor. Sometimes the information on the internet may not be from a reliable source. Another way to help manage your stress is to stay active. And I know that's been a huge challenge for people during COVID, and that includes myself. There's been a lot of Netflix watching, at least for me. And so one of the things I started to do was I'll watch Netflix, but now I do it while I'm biking in the house on a bike. So that was helpful for me. But the idea is being active is important for your heart, but it's also been shown to improve your mood. So find ways to be active at home and also put the screens down, turn off the television and take a walk outside, which given the nicer weather and less pollen is becoming a little bit easier. Another thing that COVID has really brought out is the idea that it's important to stay connected with others. Talk to your family, friends on the phone, texting or online, or talking from a social distance that's still safe. But sharing your feelings can help reduce your stress. It's also important to sort out your feelings, identify what's that underlying cause that's keeping you upset, or maybe what's driving that anxiety. It can be really important to help you figure out how to modify your life to address that issue. Some people really enjoy journaling. It helps them reflect on their feelings and experiences and also let go of some of those negative thoughts that may be driving either anxiety or depression. And I also kind of want to go back to this idea again of letting others help. There are people in your life who want to help you, making a list of tasks that you might need help with, and also just being mindful of asking for and accepting help from family, friends, and coworkers. I think I personally have the tendency to take on more than I can choose sometimes. And asking for help when I need it would probably reduce stress. And it's something I'm still trying to work on. If stress does become a concern, we definitely want to encourage folks to reach out to a licensed mental health counselor, like a psychologist or a psychiatrist. Therapy is a great way to help manage those symptoms. And in some cases, a doctor may also recommend medication to help you feel less depressed or less anxious. I also wanted to specifically spend a moment on ways to control what's in and what's not in your control during COVID. I think it's been difficult for a lot of people to understand the choices other people are making, understand how to follow certain regulations. And a virus that kind of spreads at uncontrollable times can make you feel helpless and a lack of control. So focusing on what you can control versus what's outside of my control can really help me feel more efficacious about what I can do to manage this risk. So focusing on what's important to me, taking breaks from social media or listening to news story about the pandemic can also be good. Watching the news 24/7 can create anxiety in some people. So just being moderating, watching the shows in moderation can be helpful. wearing a mask, following social distancing, doing what the CDC recommends, seeking support and offering support when you need it is an excellent way to stay within your control. Also, developing a routine to be active at home or active in ways that are consistent with the situation with the COVID cases. And also providing reassurance to young people can also make them feel like they're safer. Things that are outside of your control are other people's decisions, and I cannot reinforce that enough. We don't have the ability to help people make better decisions. We can encourage them, we can educate them, but at the end of the day, people make choices. Understanding that that's outside of your control can help reduce that anxiety. You also really can't control the duration of the outbreak, some of the policies been enacted, or the effects on the economy or family members and friends. So again, I really encourage folks during this time to focus on things that I can control versus I can't control to reduce that stress and anxiety related to COVID. I would also say that it's real important to find ways to help yourself relax. For some people, relaxation techniques such as deep breathing, meditation, yoga are excellent ways to help manage your stress and are also physically good for your body by reducing that physiologic stress response. At the end of the presentation, I actually provide a whole bunch of links to videos online, apps that are free, and also some written scripts to help you get started if that's something you're interested in. I also will strongly encourage people to schedule time for self-care. It's just as important as a medical appointment, so everybody can find 10, 15 minutes, 2 days a week. Start there. It doesn't have to be every day. It doesn't have to feel overwhelming, like you don't have time for it. I will encourage folks to take 10 minutes before you get into the house, sit in your car for a minute, listen to music, do something as little as that, but schedule it so that it's got that priority in your life because it is that important for your heart and your health. I also try to encourage folks to get plenty of sleep and avoid alcohol, drugs, and too much caffeine and sweets. I know during times of stress, it can feel like those start to increase a little bit, so just try to be mindful of that. And also deciding which tasks and activities are most important and deciding what things you might be able to say no to if you're feeling more acute stress and need to sort of reduce the stressors in your life. Making a list of what's super important and things that could be set aside can be really helpful. I also just want to highlight our service here at UNC, the Cardiovascular Behavioral Medicine Service. UNC is actually one of 4 clinics in the United States to have a cardiologist in or have a psychologist in cardiology. It's an incredibly unique thing that UNC offers. If that is something that you think would be helpful for you to have treatment for anxiety, stress, depression, especially if it's related to your heart disease, please let your cardiologist know and they can place a referral. We can do appointments in person and virtual visits. And I think it's really important to just focus on what we do. It's not talk therapy, it's very specific skills focused therapy based on science that we've seen is helpful for treating psychological issues related to heart disease. And the primary goal of our service is to provide patients and their families with the knowledge, tools, and skills they need to successfully manage their heart condition. And a secondary goal that we're hoping to get started in the next year or so is to train future psychologists to provide psychological care to cardiology patients throughout North Carolina. Again, every cancer center in the United States that's an accredited cancer center has a psychologist on staff. There's only 4 of us in the United States doing this in cardiology. So if we can increase the number of psychologists who are available to patients, I think it would be a really good thing. And again, I encourage folks to take a look at the end of the presentation. There are a bunch of resources, website links, and I hope those are helpful as well. And that's all I had. Thank you guys so much for having me.
Thanks, Lindsey. And you've got some questions. We have some questions for you. Are you up for them?
Absolutely.
That was a great presentation. And I find myself looking at those things and looking at the things that I need to do and hopefully will do. So there's been a couple of questions that were sent in online and in the chat room. And there was one that, how would one determine if high blood pressure is due to mental health or cardiac issues?
Ooh, that's a good question.
A mouthful.
That is, so hypertension or high blood pressure can be driven by a number of biologic factors, but if you have stress or anxiety, that can certainly aggravate those underlying factors. We also know that treatment of anxiety, stress, and depression can help reduce high blood pressure. So if that's an issue that you're concerned about, treatment for stress or anxiety can certainly help, along with medications and other therapies to help reduce that high blood pressure.
There were some other questions on the screen that have disappeared from me, so I'm not quite sure. Oh, they're there. Are anxiety and depression risk factors for heart disease or a byproduct of heart disease? I think that's a really good question.
Oh, could you say that one more time?
Are anxiety and depression risk factors for heart disease, or are they a byproduct of heart disease? So do you have anxiety and depression because you have heart disease, or are you at risk because you're anxious and depressed?
It's the chicken or the egg. Okay.
Yeah, I think so. I don't think there's the right answer to that question. But.
So I would say that the research strongly suggests, and research in particular that we've done here at UNC suggests that it's a mix of both. For some folks, we know that people without any pre-existing cardiovascular conditions or comorbidities, if they have a chronic health condition like PTSD, they do have a higher risk of developing new onset cardiovascular disease compared to people who do not have those same chronic health condition or chronic stress conditions. We also know that there's just a higher prevalence of anxiety, stress, depression, and mental health issues in patients with heart disease, and that can contribute to a higher symptom burden, some more intense symptoms, but also worse health outcomes. So I think that it's in some cases, it can be a contributing factor to new heart disease, but it also can make existing heart disease more difficult to manage.
Absolutely. It's anxiety in women particularly. There was a question on the thoughts about Tai Chi and management of depression.
Whoever wrote that, I love that question. So one of my mentors actually at Brown actually did a great study showing the cardiorespiratory benefits of Tai Chi and how it might be as helpful as cardiac rehabilitation, which is a well-established program for people who have a cardiac event to help them improve their physical health, emotional and social coping as well. And so there is preliminary evidence in a larger randomized trial looking at the cardiovascular benefits of Tai Chi. I will say that I tried it once and I wasn't very good at it, but I think it's a wonderful way to help manage stress, and it's also got a lot of health benefits. So I think it's fantastic.
We've done some, not Tai Chi, but some of the exercise type activity with cardiac rehab patients, and it's always shown a benefit. There's a question that do patients need to be seen in cardiology before they can be seen by you?
A great question. So because it's right now our clinic is just 1 day a week, we've been taking referrals from cardiology providers. But if folks are being seen in the UNC system or even outside the UNC system, they can certainly ask their primary care providers or try to identify a mental health provider in their community. I put a whole bunch of links at the end of the presentation that kind of will help folks identify what are the best options for them, particularly how to have those services covered by insurance, because out-of-pocket care can be very expensive, but there are a lot of options where it's quite a minimal copay. So,
thanks. There is now a question on how you can help someone who has heart issues and is depressed, but they're not taking action themselves. The depressed person.
Yeah. So I think that's a real common situation where, I think a lot of us, myself included, will see loved ones who are struggling, and how do we get them the help that they need so that they're healthier in the long term? I think recognizing that we can't control other people's actions is a real important start. Identifying what's important to that individual. Do they want to live longer? Do they want to better manage their symptoms? And anchoring that supportive conversation about what's important to that individual is something that can be really helpful. And being there to provide education and support as needed can also be very helpful. And just hoping that at some point they may be ready to engage in treatment.
Yeah, I think just being there for people that are depressed, trying to figure out ways to support them and be positive. There is there's a question that I would like to know. So as we know now, our patients will now have immediate access to their charts, including the notes and labs. And is there a way that we can help? Are there recommendations for our patients to balance staying informed and involved in their care while not becoming overwhelmed and anxious by information? I don't know if we know the answer to that one yet. You might.
It's an ongoing discussion. So I will say that for some folks, more information is better. For other folks, less information and direct communication with their healthcare provider is the best way for them to receive information. If you consider yourself somebody who becomes anxious when you read things in the newspaper or online about various health symptoms, it may not be helpful to read the raw data reports, and instead schedule a visit with your care provider so that they can explain the results to you. Because a lot of times it has a lot of medical jargon and it can be confusing, and understanding what are the important facts of the note can be very helpful. Whereas some people, if you're a nuts and bolts kind of person and it helps you understand things a little better, that could be advantageous. Again, I think it's understanding what's working for you and how you process information.
I totally agree. I just think that if they get their cholesterol of 300 before I see it, they can sit there and worry about it for a while. But I think we're just gonna have to come to some happy medium. One of the folks that's on this call on the meeting said, "I'm so excited and impressed with UNC cardiology adding a behavioral component to assessment and treatment, mind and body connection. Are you including yoga and meditation in your resource links? And what about acupuncture?"
So I did include links for some free apps and also some videos that we've used online to encourage folks to engage in kind of other like yoga and stress management activities, and as well as some of the breathing exercises. There's also information on sleep. I know that's been a huge thing in the pandemic. A lot of folks, particularly women, coming in and reporting symptoms of insomnia or frequently waking up in the middle of the night. We know that's a huge component for cardiovascular health and prevention. So there's some free apps in there, and I strongly encourage folks to check those out. And I think if we can get a class going one day, I think it would be really fun to actually do a yoga intervention here at UNC. So it's kind of a long-term goal.
I think it's a good goal. And I'm gonna tell the Lindsey that we're up on the status board in APOD at the clinic. I just got a text from them. There's another question that says, is chronic pain considered a risk factor for heart disease?
So that's a really good question. We know that one of the issues with chronic pain is that may change certain medications that people are taking or may be wanting to take. And I think Dr. Miller may be able to speak more to that, those particular issues, because in certain situations, we wouldn't advise those medications for patients. But also having untreated pain can be, is very highly associated with anxiety and depression, and those things do affect heart disease. So I think it does have an indirect relationship and possibly even a more direct relationship.
Yeah, I agree. I think it does, because it's a vicious loop, because you don't want people to have pain because their blood pressure goes up. And then if you give them something that will control their pain, you may be causing them to be addicted. You may be using NSAIDs that again raises their blood pressure on top of their pain. And so it's a real individualized thing, but I think we can, you just need to work with the patient on it, but do realize that chronic pain in somebody is going to be an issue with their heart. Just like chronic stress, stress keeps you sort of at a higher adrenaline level, and that's not, like the freshman 15 is kind of always on. Let's see, there's one, how about mindfulness therapy? Has this been tried? I noticed UNC has a lot of mindfulness studies. I see where this could help. And I think you somewhat addressed that.
Yeah, sure. I could just touch on that a little bit more. So mindfulness-based stress management, it's MBSR, mindfulness-based stress reduction. There have been a number of clinical trials that have shown health benefits, certainly quality of life benefits, and improved stress management in patients with heart failure, coronary artery disease. And some of those benefits in particular have been shown in women. And so I think that's a really important thing. In addition to sort of the traditional meditation and mindfulness-based therapies, I think it's really important to underscore the importance of just being active. There have been a number of large clinical trials looking at cardiac rehab and other fitness programs to help patients be more active. And in fact, there was a benefit to living longer found in women versus men. They didn't see that benefit. So if I can underscore anything, being active means walking a couple blocks every day. It doesn't necessarily have to be on a treadmill. But again, just being as active as possible is one of the things that we know that can help you live longer and live a better quality of life.
Absolutely. Walking anywhere and anytime, if you can do it. Get your head all straightened out. Any more questions from anybody? I'm going to turn it over to Brian then.
Thanks, Paula. And Dr. Rosman, thank you so much. That was just a great presentation. I hope that my mother was listening to that. I can't agree with you more with just the different things you talked about. And I know that our guests are probably not in their head just like me. But I did want to just let everyone know that there are a number of resources that Dr. Rosman pointed out throughout our presentation. You can see them right here on this slide. And I know this question was posed earlier on. These resources will be shared with each of you. You will receive a follow-up email within the next few days or early next week. And this will be included. So you don't need to be frantically trying to write this down or take pictures of the screen. We'll take care of you on that end. And I know that in the chat for our presentation today is the next symposium session, which will start at 2:30. We hope that you can join us for that. If you haven't signed up, it's not too late. You can do that all the way up to when we begin. And I did want to let you know that we do have a survey that you'll get access to that shortly after our webinar today concludes. It's really short. It's probably, I think it's like 4 or 5 questions. We would really appreciate if you can fill that out for us. It helps us in looking at what we did well, what we can work on. And then also, if you have any interest areas, whether it's women's heart disease or other areas within health, please let us know. We've had, I believe, our special events guru, Allison Bernowski, has told us over 75 of these kinds of virtual events over the last year. So we're doing a lot of good work, and we want to make sure we get the information out to everyone. And then one thing I did want to touch upon, my job as director of development, working with UNC Cardiology, is I get to partner and collaborate with these awesome people. So Dr. Rosman, Dr. Miller, and then the rest of our team here at UNC Cardiology. And the one thing that has made a huge difference is contributions and support of the Women's Heart Program. One thing Dr. Miller, I know, has shared in the past is, back when we first started, this was something that in the number of maybe 25 to 30 women came to, and it has now grown to well over 100. And we're aiming to spread the word even more. And the reason that was possible is because we had some individuals who wanted to help out. And if you're interested in helping us spread the word more and to support the Women's Heart Program, and as well as Dr. Rosman and her work, we would love to talk to you, start a conversation on that. So my information is on the screen. Would love to have a conversation with you on that, and we can just take care of that at some time.
So just add one thing, Brian, is that yes, our goal is to make it available, continue to make it available free, for as long as we can, to as many people in the state as we can. Obviously, the Zoom lets us do that, but hopefully in the future, that's what my goal is to educate the women in North Carolina and help them make their own healthcare decisions.
That's exactly. We appreciate what our physicians do, and Dr. Miller, as a physician leader here at UNC Cardiology and with Women's Heart Program, she's pretty much dedicated her life to this work, and we're just really I'm very grateful to be able to work with her and to help support their needs. So thank you again for joining us today. If you do have any other further questions, you can reach out to myself, Dr. Miller, Dr. Rosman, and we look forward to seeing you get a future session. Thank you and have a great afternoon.